Welcome back to microbiology. In this video, we're going to study the microbial diseases of the digestive system and urinary and reproductive systems. So the structure to the digestive system are commonly going to be divided into two groups. With these groups, the first group is going to refer to the gastrointestinal tract or the GI tract. This is the pathway from the mouth to the anus. It's responsible for digesting food, absorbing nutrients and water into blood, and eliminating waste. It's going to include things such as your mouth, esophagus, stomach, small and large intestine, rectum, and anus. The second group is going to be the accessory digestive organs. These include the teeth and tongue, which are going to be important in tearing, mashing, and mixing food into a bolus. It includes the liver and the gallbladder. Liver produces bile, while the gallbladder stores the bile. Liver breaks down, excretes, and stores toxins. Also, it will include the pancreas. This is going to produce pancreatic enzymes that are going to assist in digesting. It also produces a bicarbonate buffer, which will neutralize stomach acid when it enters the intestines, including also the salivary glands, which are going to secrete saliva, which lubricate the food for swallowing, and also will contain some digestive enzymes. So looking at the normal microbiota that we're going to find in the digestive system, we have that's found in the esophagus, stomach, and the duodenum. The duodenum is going to be the first section of the small intestine. These are almost going to be free from microbes. They use peristalsis and rapid transport of food, which prevents microbial colonization. The tongue and teeth are going to have what we see here, the viridians, streptococci, which is going to be the most prevalent in the region. The lower small intestine and colon, which are estimated to have around 100 trillion bacteria, are going to help to provide vitamins to the host, produce flatus, convert some substances into toxins and carcinogens, and inhibit pathogens by microbial antagonism. Fungi and protozoa are also going to live in the intestine. Mucous membranes are going to help to prevent microbes from entering the bloodstream as well. So here we can see some of the different bacteria that we may find there. Escherichia coli is going to be a big one that we find in the large intestine. It is going to be responsible for breaking down food that makes it into the large intestine, and it produces vitamin K that the body can then use. So it's going to be a symbiotic relationship. It's good as long as it stays in the lower intestinal tract. Dental caries, gingivitis, and periodontal disease. So with our signs and symptoms, caries are going to appear as black holes or pits in the teeth, and they progress. They give you a toothache and sometimes tooth loss. These are going to be cavities. Periodontal disease is going to be swollen, tender, bright red, or bleeding gums that progress and could cause tooth loss. The pathogens and virulence factors we're going to have here, the caries is usually going to be a Streptococcus mutans, and periodontal disease is going to be a Porphyromonas gingivalis. With the caries, the virulence factor is going to be a dextrin pili, which is going to allow for a biofilm to form around the teeth and start to eat away at the teeth. Periodontal disease is going to be prosthesis, or it's going to be a type of enzyme that will start to eat away. Pathogenesis with the caries, which is going to be the cavities, that's going to be a bacteria-produced biofilm, which dissolves the tooth enamel, and the bacteria will then invade the dentin and the pulp. With periodontal disease, it occurs when the tartar is going to be trapped at the base of the teeth and cause swelling of gums. Pockets will form, which are then going to be colonized by bacteria. That's going to produce digestive enzymes that are then going to break down the gingiva tissue. Caries are going to affect about 99.5% of adults over the age of 65. The most have experienced this. 78% of children have their first cavity by the age of 17. With periodontal disease, about 70% of the U.S. population and 20% will lead to bone loss. To diagnose this, caries simply uses a visual inspection, where periodontal disease inspects the gums. To treat a caries, you're going to fill that cavity if it's caught early. If it's periodontal disease, you'll have scaling and use of antibacterial rinses that will be used. Prevention of both of these would be good oral hygiene, healthy eating habits, and fluoridation of water. Next, we're heading into peptic ulcers. These are going to have abdominal pain, nausea, vomiting, weight loss, chest pain, black, tar-like stools, and can lead to internal bleeding and bowel obstruction. The pathogen that causes this is going to be referred to as Helicobacter pylori. It's going to have a virulence factor using its flagella, adhesion, and urease, which is going to be an enzyme. The pathogenesis is the bacteria is going to burrow into the stomach lining, allowing the entry of stomach acid, which can dissolve the lining, creating a hole called perforation. With that perforation, then it could that's what's going to cause the bleeding. The epidemiology is that we have a fecal-oral transmission being the most likely source, but it could also be caused by stress, medications, alcohol, tobacco may worsen the ulcer symptoms as well. Diagnosis, laboratory examinations, x-ray exam, and bacterial presence in clinical specimens. To treat it, you would take an antimicrobial and an acid-blocking drug. To prevent this, you would avoid fecal-oral transmission and use good personal hygiene. This one here is going to be an older disease that we hear about quite often in water and affecting populations as long ago as 2,000-3,000 years ago. Signs and symptoms of cholera are going to be nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps, followed by dysentery, which produces a loose, frequent stool that contains mucus and blood in it. The pathogen here is going to be Vibrio cholerae. The virulence is going to be the cholera toxin. Pathogenesis here is going to be the bacteria producing the cholera toxin, which is going to stimulate the secretion of excess amounts of electrolytes and water from the infected cells. Epidemiology is that pandemics have occurred throughout history. Like I said with this one, this is going to be very common. Also, we find it often in Indonesia and South and Latin America. To diagnose this, you have the presence of rice water stool. So it looks like when you go to the restroom and it's very, very loose and you look at the diarrhea, it looks like it has rice in it. Treatment's going to be supportive care and antimicrobial drugs like tetracycline. To prevent this, there is a vaccine available, but also suggested proper hygiene. Shigellosis is going to have nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps, followed by dysentery, which also produces a loose stool, frequent stool that contains mucus and blood. The pathogen could be 4 species of Shigella. Virulent factors is that it has a type 3 secretion system, it has enterotoxins and endotoxins. Pathogenesis is the bacteria is going to invade and colonize cells of small intestine, kill the intestinal cells that lead to the formation of abscesses in the mucosa of the large intestine. Epidemiologist of this is 18,000 cases in the U.S. each year, more common in the summer than in the winter. It occurs most likely in children between the ages of 2 and 4. It's spread of illness in childcare settings and spread of family members. It also develops worldwide and it's going to be far more common than people realize. So to diagnose this, you're going to look for signs and symptoms, and you'll have the presence of this bacteria in the stool. To treat it, you're going to have supportive treatments and microbial drugs like ciprofloxacin, azithromycin, and rifaximin. Prevention would be vaccine under development. We haven't finished it yet. They are working on this, and good and proper hygiene. Next, we have traveler's disease. The signs and symptoms of this disease are going to be nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps, followed by dysentery, which produces loose, frequent stools that also contain mucus and blood. As you notice, most of these have the same signs and symptoms. In this case, this is going to have the pathogen as Escherichia coli or E. coli. Virulence factors is it has adhesions, fiambriae, and toxins. Pathogenesis is the bacteria is going to produce a Shiga-like toxin, which attaches to the surface of neutrophils and then is going to spread them throughout the body. So neutrophils are going to be a type of white blood cell. This is going to cause widespread cell death. Diarrhea is going to be mediated by the enterotoxins. Epidemiology says that more than 60% of travelers visiting developing countries may experience traveler's diarrhea. It also accounts for more than 40,000 travelers daily, or more than 15 million travelers annually. To diagnose it, you look at signs and symptoms. To treat it, you use supportive treatments that are going to be based on replenishing fluids and electrolytes, and you can take antimicrobial drugs. At the moment, there is no vaccine to prevent it. Next one, we have Campylobacter diarrhea. The signs and symptoms of this will be nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps. Also, dysentery, producing loose, frequent stool that contains mucus and blood. The pathogen here will be the Campylobacter jejuni. The virulence factor is adhesions, cytotoxins, and endotoxins. It will come in and invade the intestines, and virulence factors produce bleeding, lesions, and inflammation. Epidemiology, according to the CDC, says that more than 1 million people have this type of diarrhea each year, with 100 dying from the infection. To diagnose it, you look at the signs and symptoms, and in most cases, you treat it. Is treated without any type of resolution. You don't need to take medication. Most of the time, it treats itself. Prevention is proper hygiene after handling raw poultry, thoroughly cooking poultry, and prevention of contaminated water with stockyard, feedlot, and slaughterhouse feces. Antimicrobial-associated diarrhea is going to have signs of nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps. Dysentery is going to produce loose, frequent stools that contain mucus and blood, and you'll have a pseudomembranous colitis that's going to occur in severe cases. The pathogen here is Clostridium difficile. Virulence factors are going to be toxins and endospores, and the pathogenesis has the bacteria overgrowing in the colon, when antimicrobial treatment is going to reduce those numbers of other bacteria, which normally keep it in check. So it's going to be advantageous or one of those that's going to take advantage of the situation when you've reduced the number of other bacteria, usually due to taking an antibiotic. The toxins are going to damage the colon tissue and kill cells, leading to considerable fluid loss. You'll have inflammation and the formation of lesions that are going to produce pseudomembranes. Epidemiology is a byproduct of modern medicine, unfortunately. This is what's going to happen when you take antibiotics sometimes. Any antimicrobial can trigger this disease, but there's about 500,000 cases that occur each year in the United States, with about 15,000 deaths. To diagnose it, you have the presence of the bacterial toxin in the stool, and this can be also looked at through a colonoscopy. To treat it, you would use antimicrobial drugs. To prevent it, avoid unnecessary use of antimicrobials, things such as antibiotics. Next, we have salmonellosis and typhoid fever. These are going to create nausea, vomiting, diarrhea, loss of appetite, abdominal pain, and cramps. Also, they will have fever, headache, muscle pain, malaise, rash, and intestinal hemorrhaging. Dysentery will produce loose, frequent stools that contain mucus and blood. The pathogen that's causing this is going to be the Salmonella enterica serotypes. So we have the typhi and the paratyphi, which create typhoid fever. And we have the serotypes enteriditis and typhimurium. This is going to create the salmonellosis. The virulence factors are going to be that it has the adhesion ability, so it had adhesins, type 3 secretion systems, and toxins. Pathogenesis is the bacteria is going to be able to tolerate acidic conditions of the stomach and is going to pass through the intestines where they attach via specific adhesins and introduce toxins into the host cells. Epidemiology. You have typhoid fever that's acquired by contaminated food or water and common among poor people in the southern hemisphere. Salmonellosis is often acquired by consuming contaminated eggs. 12 to 30% of typhoid fever patients are going to die without administration of antimicrobial drugs, so it's very important to be treated. 45,000 cases of salmonellosis are going to be found in the U.S. each year, with 300 to 400 cases of typhoid fever in the U.S. each year. In order to diagnose this, they're going to find the salmonella in stool. You can treat it using antimicrobial drugs like ampicillin and ciprofloxacin, and use supportive treatments like fluid and electrolyte replacements. In order to prevent this, you would have proper hygiene, especially in the kitchen and when preparing and cooking food. Bacterial and food poisoning is going to create nausea, vomiting, diarrhea, cramping, discomfort, bloating, loss of appetite, and fever. They may also produce weakness, headache, and difficulty breathing. The pathogen here is usually going to be Staphylococcus aureus. There's going to be 5 enterotoxins that are going to be the virulence factors. Pathogenesis is the bacteria is going to grow and secrete toxins. The epidemiology shows that outbreaks are going to be associated with social functions, and a number of cases are usually going to be unknown. To diagnose this, you look at signs and symptoms, and you're going to treat it with supportive treatment, usually fluid and electrolyte replacement. To prevent this, you need proper hygiene in the kitchen, so make sure that you have good hygiene while cooking and preparing food. Next, we're going to move into some viral diseases of the digestive tract. First, we're going to cover oral herpes. These are cold sores, fever, malaise, and muscle pain are going to be signs and symptoms. The pathogen is going to be the human herpes virus 1, or HHV1. Its virulence factor is going to be syncytia. The pathogenesis is the virus is going to enter through cracks or cuts in the mucous membranes. The virus then reproduces in the epithelial cells near the site of the infection, which is then going to trigger inflammation. From there, we end up with cell death and skin lesions. Latent infections in sensory nerve cells and outbreaks will reoccur, but subsequent lesions are going to be generally milder. Epidemiology is that infections occur by casual contact in childhood usually, and accounts for about 90% of cases of HHV1. Most of the time, it's asymptomatically infected at about 80% of children by the age of 2. Diagnosis is going to be signs and symptoms, laboratory examination, and microscope and immunoassay. To treat this, you're going to use topical creams that contain things like aclobor. Prevention would be avoiding direct contact with infected individuals. Mumps is going to be swollen parotid salivary glands. You'll have face pain, fever, headache, and sore throat. The pathogen here is going to be the rubeovirus. Pathogenesis is the virus is going to enter through the respiratory system, multiplies, and then invades the blood. It then infects many of the organs, including the salivary glands. Epidemiology nearly non-existent in developed countries due to immunization. To diagnose it, you look at the signs and symptoms. There's no specific treatment, but it could include just simply comfort of care. Prevention for this will be a vaccine. You've got your measles, mumps, and rubella vaccine. Viral gastroenteritis causes abdominal pain and cramping, diarrhea, nausea, vomiting, fever, chills, clammy skin, weight loss, loss of appetite, and dehydration. The pathogen here is going to be callivicular astrovirus, and rotavirus. The pathogenesis is the virus is going to enter the digestive tract in contaminated food or water, and then it's going to infect the cells that line the intestinal tract, where they're going to undergo a lytic replication. That means as they replicate, they're going to kill the cells around them, burst, and go to more cells. Epidemiology, you're going to have more cases that occur in the winter. It's going to cause outbreaks in things like daycare centers, schools, and hospitals. With the rotavirus, it's going to cause about 50% of infantile gastroenteritis, 100,000 hospitalizations, and 100 deaths per year in the U.S., and will kill about 600,000 each year in developing countries. To diagnose this, you're going to look at laboratory examinations and serological testing. To treat it, there's no real specific treatment, but supportive care that provides plenty of fluids and electrolytes. Prevention would be a vaccine for the rotavirus and water purification, hand washing, safe food handling procedures, and disinfection. Viral hepatitis will cause jaundice, dark urine, abdominal pain, distension, nausea, vomiting, weight loss, fatigue, fever, and liver damage. Now, abdominal distension means it's going to distort or extend, cause that stomach to bloat. The pathogens will be quite a few. It's going to be hepatitis virus A, B, C, hepatitis delta virus, and hepatitis E virus. The pathogenesis is the virus is going to enter the body and replicate in the liver, causing cell lysis or cells to burst. Hepatitis A and E are going to spread via fecal-oral route. Other hepatitis viruses can spread sexually and through contaminated needles, resulting in chronic infection. About 1/3 of Americans will have HAV antibodies. 1.25 million chronically will be infected with HBV. 4 million Americans are going to have HCV, and that's going to kill around 9,000 a year. And then HEV will infect certain endemic regions. To diagnose it, you're going to have the signs and symptoms that you look at and laboratory examinations. So they're going to go in and maybe do a serological testing. They're going to look for viral proteins in body fluids and liver function test or liver biopsies. To treat it, you have basically supportive care, rest, reduction of inflammation, take some immunoglobulins, alpha interferons, and ribavirin. To prevent this, you need good hygiene, protected sex, or abstinence, and there's also vaccines available for HAV and HBV. Giardiasis, or Giardia, which it's more commonly known as. These are often asymptomatic. 1 to 2 weeks in, gastrointestinal distress will start. You have severe, greasy, frothy, fatty diarrhea, abdominal pain, flatus, nausea, vomiting, loss of appetite, infective absorption. Diarrhea and associated symptoms can last up to 4 weeks. Giardia intestinalis is going to be the pathogen, and what it does is it creates cysts. Pathogenesis, infection results from ingesting cysts that are found in contaminated water that cause ingested cysts to release what's called trypanosomes in the small intestine. They're going to multiply and interfere with intestinal absorption and nutrients. Epidemiology, it's going to be common waterborne GI disease in the United States. A lot of hikers and campers are going to get this particular illness. They're at risk because they often drink out of water sources that are close, and they don't really have a way to clean that water. These are actually increasing in numbers worldwide. So to diagnose it, you would take microscopic observation of the Giardia in the stool. To treat it, you do need antimicrobial drugs. Supportive care would be replacing lost fluids and electrolytes. To prevent it, you would avoid drinking unfiltered stream or river water, water out of creeks and ponds, water filtration in endemic areas, and good personal hygiene. Cryptosporidosis will present with severe watery diarrhea, a headache, muscle pain, cramping, nausea, fatigue, fluid, and weight loss. Pathogen is going to be Cryptosporidium parvum. The virulence factor is going to be a sporozoite and oocyst. Pathogenesis is not generally understood. The theory is that the oocysts are going to be ingested that cause intestinal cell destruction and subsequent inflammatory response triggers. This is going to trigger a loss of electrolytes and waters and decrease the absorption of nutrients. Epidemiology states the results from drinking contaminated water, direct fecal-oral transmission, and immunocompromised persons are going to be at risk for severe or chronic disease. Diagnosis is going to be presence of oocyst in feces. Treatment is going to be supportive care like replenishing fluid and electrolytes. Prevention is good hygiene, avoid consumption of contaminated food or water, and avoid fecal exposure during sex. Next is our amoebiasis. So we're into the protozoans. I forgot to go back and tell you about that. So with amoebiasis, these are going to have luminal amoebiasis that's asymptomatic. We have invasive amoebic dysentery that's going to create severe diarrhea, colitis, appendicitis, and even bloody stool and pain. Invasive extraintestinal amoebitis is going to cause necrotic lesions. That's where it causes tissue death in various organs. So the pathogen here is going to be the Entamoeba histolytica. Its virulence factors are going to be cysts, adhesion proteins, proteases, which are other types of enzymes, proteins that create ion channels in the host membranes, and toxic proteins. Pathogenesis. You're going to have cysts that are going to be ingested. They travel to the small intestine where they're going to develop into trypocytes. These are then going to travel to the large intestine where they begin to cause symptoms. Epidemiology is going to be transmitted by consumption of contaminated food or water and contaminated hands or oral anal intercourse. Majority of individuals will develop luminal amoebiasis. Diagnosis will be microscopic observation of the entamoeba in the stool, intestinal biopsies, and serological identifications. Treatments, you'll have supportive care, which will be oral rehydration therapy, and anti-amoebic drugs, antibacterial agents, and antidiarrheal drugs. So prevention would be proper hygiene, safe sex practices, effective water processing, and avoid uncooked foods. Next, we're leading into helminthic infestation of digestion systems. So this will be like your worms. Tapeworm infestation usually is going to be asymptomatic, but could cause nausea, abdominal pain, definitely weight loss, and diarrhea. The pathogen here is going to be the Tinea saginata, which is going to be a beef tapeworm, or the Tinea cilium, which is going to be the pork tapeworm. Virulence is it creates a scolex, a proglottids, and cysticercia, or cysts. Pathogenesis is infected by consuming cysticercia in meat. So basically you ingest these cysts, which are going to be found in the muscles of the animal, and then of course what we eat is the muscle. That's going to be what we consider meat. Epidemiology is going to be high incidences in regions of inadequate sewage treatment and regions where humans live very close contact with livestock. It's kind of rare in the United States. So to diagnosis, you have the presence of the proglottids in your fecal sample. To treat it, you're going to use anti-helminthic drugs or drugs that treat for worms. And sometimes you might have surgery, but that's going to be rare. To prevent this, thoroughly cook your food or freeze your meats, thoroughly inspect the meats, and have good sewage treatment. Next, we have a pinworm infestation. With this one, we're going to have perianal itching. Peri means around, anal, of course, your anus, irritability, decreased appetite, and weight loss. 1/3 of cases are going to be asymptomatic. The pathogen here is going to be called the Enterobius vermiculus, or vermicularis, sorry. Virulence factors are going to be female eggs. The pathogenesis is that eggs are going to be ingested, and upon hatching, males and females are then going to mate in the intestinal tract. Eggs are then going to be deposited near the anus, which is going to cause scratching. That scratching dislodges the eggs, and that's going to settle in the clothes or bedding, or could actually make it into the fingernails or hands, be reconsumed in the food or water, or get into others' food and water. Eggs are also going to be ingested by scratching when the eggs are going to be found under fingernails, causing reinfection. Epidemiology. You have infections that are commonly going to occur in children because they always have their hands all over themselves and put them in their mouths. The Enterobius is going to be the most common parasitic worm that's found in the United States with about 40 million cases. It's going to infest about 500 million people worldwide. So to diagnose this, you have microscopically identifying the eggs or visually identifying the adult pinworms because you can see them. Treatment is going to be anti-helminthic drugs, and then prevention, strict personal hygiene, thorough laundering of linens, and hand washing to prevent spread. Now we're going to move on to our microbial diseases of body systems, of the urinary and reproductive systems. So here we're going to look at portions of the urinary system. We have the kidneys, which are going to consist of nephrons. The nephrons are going to filter blood to form urine. You're going to have about 1.25 million nephrons. Inside of each nephron, you're going to have a structure referred to as a glomerulus. This is going to be a ball of capillaries, and you can see that in that center picture or enlarged all the way to the right. Ureters are going to be attached, and they're going to carry the urine to the urinary bladder. The urinary bladder is responsible for storing urine, and then when you're ready to use the bathroom, you relieve yourself and it comes out through the urethra. So here you can see the structure, how it's going to be set up in female versus male. So first, looking at this, the urinary structures will also go along with the reproductive structures. So the male reproductive structure is going to consist of testes, which produce sperm, a scrotum, which is going to be an external pouch that houses the testes, and a duct system. The epididymis, which is going to be the storage area for sperm and also where they mature, and the ductus deferens, or sometimes referred to as the vas deferens, in which the sperm will travel to the urethra. Accessory glands are going to be the prostate, which adds fluids to sperm to help form the semen and the penis. Now with the female reproductive system, that's the one that you see on the right, it's going to consist of ovaries, which produce haploid ova. One's going to be released monthly, so the ova is going to be the egg. Uterine tubes are going to connect the uterus, connect to the uterus from the ovaries. The ova are going to be swept through these tubes to the uterus through ciliated cells that you'll find there. The uterus, also known as the womb, is going to allow implantation of a fertilized egg. The vagina is going to consist of a mucous membrane that lines that area, and it's going to act as the birth canal. The external genitalia will consist of the clitoris, 2 sets of labia or lips, and a vaginal opening. Here you can see those structures a little bit more. So we see the female first here, and then the male on the right. Now going into some of the normal microbiota of the urinary and reproductive systems. Within the urethra, you're going to have a species of Lactobacillus, Staphylococcus, and Streptococcus. Urinary organs and urine are going to be sterile due to the normally acidic pH of the urine and the flushing action of urination. The female reproductive system will also consist of the vagina, and that's going to be colonized by various microorganisms that depend on the hormone levels of that female. Male reproductive systems are going to be regions that are going to be above the prostate, which are going to be sterile. Bacterial urinary tract infections. These are going to create frequent, urgent, painful urination. Urine may be cloudy with a foul odor. The pathogen usually is going to be E. coli. The virulence factor is going to be the flagella and attachment of Fimbriae. The pathogenesis is itself inoculating fecal bacteria that gets into the urethra. Lots of times for females, it's simply from not wiping properly after a bowel movement. Epidemiology would be more common in females. The urethra is going to be much shorter and closer to the anus. Diabetics, nursing home patients, elderly men, and those that don't drink a lot of fluids or adequate fluids can also have a higher instance of getting a UTI. Diagnosing this would be signs and symptoms and a urinalysis. To treat it, many cases resolve without treatment, but you can have antimicrobial drugs like cephalosporin, sulfonamide, and then other forms of like penicillin. If it gets really bad, sometimes you might need IV administration for severe infections. To prevent this, you limit contamination by fecal microbes for females, wiping front to back after defecation, urination following sexual intercourse, and refraining from douching, using forms of birth control other than diaphragms, and make sure that you drink plenty of liquids each day. This one we see leptospirosis. This is going to cause an abrupt fever, myalgia, muscle stiffness, headache, nausea, vomiting, diarrhea, but rarely it will be fatal. The pathogen here is going to be Leptospira interrogans. No virulence factors known. Pathogenesis is infection occurs following direct contact with urine of infected animals or animal urine contaminating streams, lakes, or moist soils. It's going to penetrate intact mucous membranes through invisible cuts and scrapes in the skin. Then it's going to travel through the bloodstream throughout the body until it resides in the kidneys. Epidemiology is going to be transmitted by contact with urine of infected animal or urine-contaminated water. Farmers, ranchers, veterinarians, butchers, reactionists are going to be most likely at risk here. To diagnose it, you're going to look for an antibody test Treatment, you're going to use antimicrobial drugs. So you can use things like deoxycycline, erythromycin. You can even, if it's bad, end up with an IV of ampicillin. To prevent this, you would avoid contaminated water, and you have vaccines for your livestock and pets. Non-venereal diseases of the reproductive system will have staphylococcal toxic shock syndrome. This is caused by a bacteria. So it's going to cause a sudden onset fever, chills, vomiting, diarrhea, low blood pressure, confusion, and severe red rash. Shock if untreated. The pathogen here is going to usually be the different forms or strains of Staphylococcus aureus. The virulence factor is going to be the toxins that it creates. Pathogenesis is going to be strains of Staph aureus are going to produce toxins which are going to be absorbed into the blood, triggering toxic shock syndrome. The epidemiology shows that most cases occur in menstruating females. Diagnosis will be signs and symptoms, and laboratory tests, which are usually going to be blood cultures. Treatment will be medical emergency if necessary, removal of foreign materials such as tampons, sponges, diaphragms, or nasal packing, supportive treatment with IV fluids and antimicrobial drugs. Prevention would be to avoid tampons, or using less absorbent tampons will reduce the risk. Avoid or use vaginal sponges and diaphragms for birth control intermittently for short periods of time. Bacterial vaginosis. This is going to create white vaginal discharge with a fishy odor. Causes itching and irritation. In general, sometimes it could be asymptomatic. The pathogen here is going to be various different types of anaerobic bacteria. So we could have Gardnerella vaginalis or Mycoplasma hominis. Pathogenesis, no known cause or causes. Decline of lactobacteria resulting in a higher pH, possibly in the vagina, may promote or allow for this bacterial growth. Epidemiology says it's associated with multiple sexual partners or vaginal douching. Diagnosis would be signs and symptoms. Treatment, taking antimicrobial drugs, so oral or vaginal metronidazole or clindamycin, and prevention, so avoidance of douching and abstinence. Next, we have vaginal candidiasis. This is going to be severe itching and burning as its symptoms. It is caused by a Candida albicans. This is going to use a pseudohyphae as its virulence factor. So this is actually going to be a type of yeast or bacteria. So the pathogen as bacteria overgrows from a vaginal pH or microbiotic change. It's going to cause it to multiply rapidly, which triggers inflammation and manifestation. Epidemiology says that 75% of women will experience at least once, or 50% of women more than once. Is transmitted between individuals and can become systemic if immunocompromised. Diagnosis would be the identification of the candida or presence of symptoms of diagnostics. Treatment would be antifungal agents, and prevention, avoiding excessive use of antibacterial drugs and avoiding persistent moisture. Next, this is going to be bacterial STDs. First here is going to be gonorrhea. In men, it gives painful urination and purulent discharge. In women, it's often asymptomatic. Could cause the pelvic inflammatory disease eventually. The pathogen and virulence factors, well, the pathogen is going to be what's referred to as Neisseria gonorrhea. The virulence factor is the Fimbriae, capsule, and endotoxins. Pathogenesis will be the bacteria is going to attach to the epithelial cells of the mucous membranes of the genital, urinary, and digestive tracts in humans. Epidemiology says it occurs only in humans. Risk is going to increase with frequency of sexual encounters and more common amongst men than women. To diagnose this, you're going to have the presence of bacteria in pus. If it's asymptomatic, you're going to do a genetic probe. Treatment will be antimicrobial drugs, and usually they use a broad spectrum antibiotic. Prevention will be safe sex practices, aggressive detection, and screening of sexual contacts of carriers. Syphilis is a common STD that's going to have been around for hundreds if not 1,000 years or longer. Signs and symptoms of primary syphilis is going to be small, hard, extremely infectious cankers or lesions. Secondary syphilis is going to be malice, long-lasting contagious skin rash, and a sore throat, followed by a headache and mild fever. Latent syphilis is asymptomatic, and tertiary syphilis causes swollen lesions called gummas on the skin and other organs, destruction of the cardiovascular and central nervous system tissue, and personality changes, insanity, and blindness. The pathogen here is going to be Treponema pallidum. It's going to have virulence factors that we are not yet able to identify. It's very difficult. Pathogenesis, primary syphilis. You're going to look at the cankers and where they form at the site of infection, which this is going to fill with serum of that infection. It lasts usually about 3 to 6 weeks and then will disappear without scarring. Secondary syphilis, once the invasion occurs in the blood, is going to spread throughout the body and cause infectious rash lesions. Latent syphilis is going to show where that rash disappears, and then your tertiary syphilis could cause complications that are associated with inflammation and hyperimmune responses to the pathogen. Gummas and other issues can result. The epidemiology is going to say that it's transmitted mostly via sexual contact. Sometimes it can be transmitted from mother to child. Most individuals do not develop tertiary syphilis. Syphilis does occur worldwide at about 12 million new infectious cases annually. To diagnose this, you have a primary, secondary, and congenital syphilis antibody test. Tertiary syphilis is going to be very difficult to diagnose. Treating it is used usually with antimicrobial drugs like penicillin G. It's going to be used for all of the different stages except for tertiary syphilis. Prevention would be sexual abstinence, mutual monogamy, and safe sex practices. Next, we're heading on to chlamydial infections or chlamydia. Females, usually asymptomatic, may result in a PID or pelvic inflammatory disease. With males, it has painful urination and pus discharge from the penis. You have lymphogranuloma veruneum case is going to cause genital lesions and bubo in that region of the groin. It's going to be accompanied by a fever, chills, anorexia, and muscle pain. The pathogen here is going to be Chlamydia trachomatis. Virulence factors, it develops from a developmental cycle. We have elementary bodies that are going to be the infective form and reticulate bodies, which are going to be the reproductive form. Pathogenesis is going to enter the body through scrapes or cuts, infected conjunctival cells, or cells lining mucous membranes. Epidemiology says that most common reported STD in the U.S., and it's the most prevalent among women under the age of 20. To diagnose this, you have detection of chlamydia DNA by a PCR or polymerase chain reaction test. You take antimicrobial drugs to treat it, like tetracycline, azithromycin, or erythromycin, and prevention would be abstinence or mutual monogamy. Cankroid. In males, it's going to have soft cankers or one ulcer. In females, you'll have soft cankers or 4 or more ulcers, painful urination, and sometimes it even could be asymptomatic. The pathogen here is going to be Haemophilus ducreyi, and the virulence factor is going to be a toxin. Pathogenesis, you have bacteria that's going to incubate for up to 14 days and then produce toxins that will kill epithelial cells at the site of the infection and generate ulcers within about 24 hours. It may spread to the lymph nodes and produce buboes. Epidemiology says that most cases in the U.S. are going to be due to foreign travel. It spreads through sexual intercourse. To diagnose it, you're going to look for signs and symptoms, and you have laboratory tests where they're going to do stained specimens of infected tissue. To treat it, you need antimicrobial drugs like azithromycin, erythromycin, and ciprofloxacin. To prevent it, you have abstinence and mutual monogamy. Next, we have what's called genital herpes. Signs and symptoms are going to be small blisters on or around the genitals or rectum, fever, malice, myalgia, and decreased appetite. The pathogen here is going to be the human herpes virus 2, or HHV2, which covers about 85% of these. Virulence factors are going to be the virus can become latent in the nerve cells. Pathogenesis, herpes virus membrane is going to attach to and fuse with the host cell's membrane. The herpes virus will then kill the epithelial cells at the infection site, causing blisters to form at the site far from the initial infection site. The virus is then going to enter the latent phase in the nerve ganglia and become active and triggering recurrently, even less severe episodes for years to come. Epidemiology says that genital herpes or herpes quadruples the risk of getting an HIV infection. Infected people are going to shed the herpes virus and mucus secretions even in the absence of a lesion. Although it's going to be spread by non-sexual contact like vaginal birth and contact with whitlows, 4 billion people worldwide are going to be infected. We have about 86 million with genital herpes lesions, and 40% are going to be infected with HHV2 in the US. To diagnose this, you look at the signs and symptoms and you have laboratory tests. So we have a herpes virus DNA detection by PCR, where it's going to take fluid from the blisters and check it. There's no cure at this time, and symptoms are usually going to be relieved with medications. Prevention will be abstinence and mutual monogamy. Genital warts. Signs and symptoms. Warts are going to be formed on the genitalia surrounding areas. You're going to have large growths called condylomata, acumulata, and they may form up and down the genitalia, like we said. This is going to be caused by the pathogen human papillomavirus, or HPV. The pathogenesis is HPV invades skin or mucous membranes during sex. Epidemiology says transmission is going to be through skin or mucous membranes of the penis, vagina, or anus during sexual intercourse. This is going to be the most common STD in the United States. Sexually active adolescents, uncircumcised men, and sexual partners are going to equal greater risk. Diagnosis would be with signs and symptoms, and you do a DNA probe to determine the exact strain of HPV. To treat it, you're going to have methods available to remove these warts like surgery, freezing, burning, lasers, or the use of caustic chemicals. The virus may remain in surrounding tissue and warts could return. Over-the-counter medications are not going to be recommended. Prevention would be a vaccine that's available now for the HPV strain associated with cervical cancer, and abstinence or monogamy. Acquired immunodeficiency disease, or also known as AIDS. With this disease, we're going to have diseases of the skin start to show up, like shingles and herpes. You'll have diseases of the nervous system, like meningitis and toxoplasmosis. You'll have diseases of the respiratory system, like tuberculosis and pneumonia, diseases of the digestive system, like chronic diarrhea and thrush, and Kaposis sarcoma, which is going to be blood vessel cancer. The pathogen here is going to be HIV, or human immunodeficiency virus, and there's going to be two types. You have HIV-1, which is found in the US and Europe, and HIV-2, which is found in West Africa. Virulence factors are going to be a glycoprotein, GP41. Pathogenesis. Infection is going to occur by way of contact with bodily fluids through tears or lesions in the skin or mucous membranes, causing a variant production. Immune system responds by producing antibodies, while the virus and cytotoxic T cells will kill the helper T cells. These are the ones that have the CD4 cells on them. Viruses will continue to replicate, and variants are going to be released into the blood. Body's not going to be able to make enough helper T cells, causing a decline in helper T cells over 5 to 10 year periods, which will eventually impair the immune system. HIV production also increases, which results in death. Epidemiology says it's first recognized in young male homosexuals in the US. Now it's going to be found worldwide. HIV is going to be in the blood, semen, saliva, vaginal secretions, breast milk concentrated through different causes of infections. It has to be injected into the body or contact with a tear or lesion in the skin or mucous membranes. HIV is transmitted primarily through sexual contact and intravenous drug use, and can also be transmitted across the placenta and through breast milk. Certain behaviors are going to increase the risk of infection, like anal intercourse, sexual promiscuity, intravenous drug use, and sexual intercourse with anyone engaging in the previous 3 behaviors. To diagnose it, usually there's weight loss, fatigue, fever, and detection of low antibodies against HIV and other signs and symptoms. You'll also have a laboratory test done, an ELISA test. They also look for agglutination, Western blot testing, and PCR test. To treat it, you have antiretroviral therapy, or ART, antiviral drug cocktails. They help to reduce viral replication, but infection usually still remains. The disease is associated with AIDS and are treated individually. Prevention would be they're working on a vaccine, but to slow AIDS epidemic without numerous personal decisions, you need things such as abstinence, mutual monogamy, use of new or clean needles and syringes, AZT to pregnant women, blood screening for blood products and organ transplants, proper use of gloves, protective eyewear, masks, and circumcision. Now we're going to look at protozoan STDs. First, we have trichomoniasis. In females, it'll cause vaginal discharge, vaginal irritation, lesions, abdominal pain, dysuria, pain during sex and intercourse. Males, typically asymptomatic, but may cause inflammation of the urethra or prostate and painful urination. The pathogen here is going to be a Trichomonas vaginalis. Virulence factors are going to be the flagella and undulating membrane. Pathogenesis is transmissions primarily through sexual intercourse because protozoas do not produce cysts and can't survive long in relatively high oxygen concentration areas or dry atmospheres outside of the body. Epidemiology, transmission primarily through sexual intercourse. It's the most common curable STD in women. Trichomoniasis increases the risk of infection by HIV, though, and we have about 170 million cases worldwide, with 7.5 million cases in the United States. Diagnosis of this would be presence of the trichomoniasis in clinical samples and laboratory tests, such as fluorescent antibody staining and parasite culturing. To treat it, you would take oral metronidazole, and to prevent it, you would have abstinence or monogamy. So that's going to finish us up for our microbes that we're going to find in our different body systems. And I hope you enjoyed this course in microbiology.